Homeless means more than not having a place to sleep. Being homeless means having no place to save the things that connect you to your past, losing all contact with friends and family, uprooting your children from school. It means suffering the frustration and degradation of living hand to mouth, depending on the generosity of strangers or efficiency of a government agency for your survival, for your children's survival.
I don't understand why we have to suffer.
They may look broken, beaten, alone, and avoided, alienated and discriminated from mainstream society. They have nowhere to go and no one to rely on. According to the Chicago Coalition for the Homeless, there are 88,923 of these people in Chicago alone who spend their daily lives trying to survive without a stable home.
Being homeless inevitably causes serious health problems that are closely related to poverty and lack of health care. Illnesses such as AIDS, tuberculosis, and severe dental problems are all commonly found within the homeless population. These issues stem from the fact that homeless people are denied access to free health care. Those who are homeless focus more on attaining immediate needs: food, shelter, safety, and clothing. Sometimes the homeless will even exchange sex for these essentials. Knowing this, it is not surprising that within the homeless community there is a high rate of HIV.
The hardships and pain individuals living with HIV/AIDS suffer are cruel enough when those individuals have a family, friends, and stable health care. Imagine suffering through this alone, unknowing about whether you will ever receive the treatments needed to keep you alive.
Anybody who's low income, has or no income at the poverty level or below, studies certainly show that those individuals, whether they're housed and employed or whatever, if their income is low, they tend to need better nutrition.
A vast amount of deaths in the homeless community are caused from various cutaneous or skin diseases: gangrene, pellagra, scurvy, scabies, pruritus, leg ulcers, cellulitis, the list goes on. Skin diseases are caused simply from a lack of proper footwear, hygiene, clean clothing, and conditions with excessive moisture where bacteria can thrive.
I do have some clients with physical health issues. One of my clients, he has a hernia, and it's actually really affecting his ability to get a job. So, it really hurts him just to walk, let alone to do some sort of job. So he was actually just signed up for a surgery in July. So he has to wait that long, but he doesn't have insurance, so that's what you have to do. I also have a client who has prostate cancer right now, so he's determining how he's going to go forward with that. I have another client who suffers from arthritis in his feet, so it's hard to get around. All of these are part of why someone becomes homeless, because of exorbitant medical costs and what it does to your psyche can keep you from getting a job, maybe can trigger starting to use some substance. It's all related.
In January of 2003, Chicago became the first major city in the U.S. to have a plan for the homeless promoted by its mayor. Mayor Daley endorsed Chicago's plan to end homelessness and made it one of the top priorities of his administration. The plan created a blueprint for preventing individuals from becoming homeless, placed them in permanent housing, and provided services that would help promote self-sufficiency. On a larger scale, the plan represented a shift in Chicago's attitude towards homelessness, from being one of simply managing it to being one of ending it.
The 10-year plan to end homelessness has three main ideals: housing first, prevention, and wraparound services.
According to the plan, prevention meant that either short-term or one-time financial assistance would be provided.
Housing is kind of the key to everything for somebody who's homeless. Once you get housing, and you probably saw in the plan to end homelessness, the phrase is housing first, where that really is the key. Get people into housing, and then you can begin to address all of those other issues. You can begin to work with them around physical health issues, around mental health issues, around clothing is an easy one, but anything that somebody's presenting with, you can begin to address that. Getting your public benefits. It's really hard to get public benefits. Get signed up for SSI or SSDI or WIC or anything else if you don't have a physical address to put down on a form.
Housing meant that people would be moved to more permanent, stable housing arrangements, and wraparound services refer to supportive services that would help address a person's root cause of being homeless, maintain stability, and promote community integration once they have settled into permanent housing.
Within 5 years of being implemented, the Chicago Plan can boast to have accomplished the following.
Citywide coordination. With the creation of the Chicago Plan, consumers, service providers, government partners, and philanthropists worked collaboratively for the first time to make system improvements, establish best practices, and hold each other accountable for progress in implementing the plan.
Unified approach to services. In order to be funded, all homeless services must conform to a set of program models consistent with the plan's goals.
System-wide data collection. All provider programs must participate in system-wide data collection methodologies.
Agreed upon priorities. Though the Chicago Plan is a blueprint for ending all homelessness, housing the chronically homeless was one of the first priorities to be implemented.
Despite the achievements proclaimed by the plan, the Chicago Coalition for the Homeless has come up with a set of grievances regarding the level of effectiveness of the plan's actions.
Right now I'm underhoused or considered homeless, so I don't really have too many other places I can go. There are a few other places, but a lot of the services have been, cut down, and so a lot more people need help in these economic times. No, they really need more services that can help people fully, like individual counseling, group counseling, stuff to really, stipends to get them housing, get them apartments, or get them homes, get them back on the job. Like when they get job training or something like that, they don't have, when you're pretty broke and you're trying to go to work and you don't have a bus pass, you don't have a car, so different things like that.
Implementation of the current plan to end homelessness is not working.
Shelters are currently full and turning people away.
There is insufficient, affordable, permanent housing in Chicago.
Certain special populations are not being served.
The plan is extremely underfunded.